Okay, I think I'm live. Um, Thought I might well just do this live, kind of. Just instead of actually really just you know setting up a camera and doing this. Uh, it takes ages to set up the camera and then record, set it up, and I have to do it a lot anyway. Uh, yeah, this coronavirus is. I wasn't going to do a video on this, but this situation has become very fluid. As you know, that's the common phrase right now. Fluid situation in terms of coronavirus and what we're facing here in Scotland. Certainly, the situation has changed dramatically over the last, I would even say, just 48 hours, 52 odd hours. Now, with a lot of the events, a lot of big events and legislation being cancelled and brought in terms of legislation and things that are happening, which is certainly starting to affect things here in Scotland. I'm no expert. I'm just again a member of the public, just also trying to keep an eye on the situation. Mostly because I am actually a charity volunteer. I volunteer at a Chest, Heart and Stroke Scotland shop. We're getting continuous advice from Chest, Heart and Stroke Scotland actually in emails right now about what to do. It's just basically the same general advice as everybody else is getting. But obviously, I'm a big sports fan as well, and I'm seeing all of these events being cancelled. We've seen, for instance, this weekend was supposed to be the opening weekend of the Formula One season. That's obviously no longer happening. The situation was there was quite um, unusual, and I overuse this phrase, but interesting. There are lots of different steps. They were saying it was be on, but with no fans. You got no fans, uh, and then it was obviously then a couple of drivers left Australia. I think it was Leith Vettel and someone else that left Australia apparently before any decision was made to cancel the event. They've left, and then I watched the whole 26-minute video yesterday of a couple of principals of the Australian Grand Prix and the FIA, and they were basically explaining the decision to cancel the Australian Grand Prix. The Bahrain Grand Prix is now at least postponed. The Vietnamese one is cancelled, stroke postponed. So there's potential, like many other, you know, I think I've got a big hair there suddenly. But anyway, um, there's many of these kind of events are not going to be held until possibly the end of April, beginning of May. Football in here in the UK, and particularly in Scotland, I'm trying to make this a kind of Scottish-based update video. Just for any of those kind of not in Scotland and wondering what exactly is happening in the UK, all British football has been postponed right now. The Scottish leagues, the Welsh leagues, the Irish leagues, football, soccer, whatever you want to call it, they're all postponed. They're all um, right now suspended, I suppose the best word. A lot of talk today is been about what is exactly going to happen. And by the way, I know this video is probably quality is horrible. I do need to invest in a better webcam to attach to my laptop anyway. It's the information that's really more important. That the whole talk today has been about whether the seasons are going to be resumed. We are very close. We're about 30 odd games into the seasons because the way the seasons obviously work, it's normally end of July, start of August these days. To the start from the start of seasons to the end of seasons, which run about obviously approximately mid to late May these days is when with cup finals and so forth. That's all that happens, and it's right now the whole talk has been on a lot, and I don't know why Sky Sports, BBC, they've all really grabbed on to talking about football. They're all talking, grabbing exactly. Obviously, it's a large money maker for these companies, the Skies and everything like that. But a lot of them are grabbing on to football and concentrating on it, obviously trying to appeal to the largest demographic of people to actually watch them, watch their channels. It's unknown, really, what I'm trying to get at. It's very unknown what the seasons are going to, what the football associations are going to do in regards to the seasons, in regards to whether we're going to ever be able to finish the seasons, whether it's a shame because the team that I support, Dundee United, obviously, is in a great position. What does that mean? Does it mean that, are they going to go ahead with promotion and relegation based on where teams are in the league at the moment, or are they just going to call it an exhibition season and tell everybody start from the beginning again, or what's going to happen? A lot of that has been a lot of the tension. I don't know whether it's kind of ignoring, it is a little bit ignoring the general situation of what's going on in terms of medical services and everything like that. You tend to get that on these kind of situations where they kind of ignore what exactly is going on in terms of people needing help, getting help, in terms of actually having all this football coverage instead of concentrating on exactly what is happening in regards to the concentrating on sport rather than concentrating on what the procedures are and what exactly is going on, rather than anything else. I don't know what's going to happen. A lot of the sports, I think, can see, even just the public events, right now in Scotland, I think it's reported like 21 people passed away. There is in the UK, I saw it earlier, 1,140 cases of the coronavirus in total, reported at least. Whether there's tremendous amounts more unreported or not able to get a test, that's another thing that's been talked about, that some people have not been able to get the proper tests. I don't know whether that's going to spread. How a lot of countries, obviously, we are seeing countries like Italy, Ireland, they're going on lockdown. Spain is about to go on lockdown. I know one of my friends, Halil, he was supposed to go into Benidorm. That's obviously not happening. They're literally sending visit Jet2, a major, relatively major airline, literally had their planes turn around in the air late last night. They turned them around, and I don't know exactly how far the nearest one got to Spain, but they literally had them turn around and return to the UK, land. And I don't know what's happening in that situation in regards to holidays either. You're kind of stuffed, I suppose. If Benidorm was already on lockdown, and I think there's several areas in Spain that are on lockdown. Obviously, that begin. I believe the latest information is that the Spain will go into lockdown. That is kind of annoying me. That here, can see that very clearly. They're going in lockdown on Monday, I think, from Spain, and just announced just as before. I actually went on and started to do this interview, this live stream. I was watching the interview or the press conference, really, at the White House with President Trump and the administration there. I'm not a fan of Trump, but they are now adding the UK to that exclusion, the travel ban. They had an exclusion on UK basically because UK wasn't really seeing a lot of cases of the coronavirus, but now that they are looking at it again. And literally a few minutes ago they announced, about 10 or so, about 10 minutes now, this live stream, about 10, 15, 20 minutes ago, they announced that they will be adding the UK to the travel ban, which basically adds, again, if you're going to anywhere in the UK, Europe, you're pretty much stuffed if you're on holiday or anything like that. Again, in terms of the UK, in terms of Scotland, right now, as the situation goes, we are not. The legislation brought in by Nicola Sturgeon, the First Minister, is no public gatherings over 500 people. Now, right now, again, I'm a professional wrestling fan, and what is happening right now is that some companies are postponing their events, quite a few, but some are under current advice going ahead with them. In some areas are more affected than others. Right now, legislation in Scotland is that no public gatherings over 500 people, I believe it is, are allowed. So any public gathering, any event, just seeing that now, H Hunter, I'll get to that in a second. Um, any public gatherings above 500 people in Scotland right now are I suppose illegal. They're not allowed to happen right now. But we are awaiting right. I'm not sure whether it's today or whether it's a couple of days. Again, trying to kind of watch Sky News and BBC News and trying to trying to kind of gather information right now. There, I don't know whether I believe, to be honest, what I'm trying to get at, if I'm tongue tied, we are waiting on the UK government, Westminster, to actually say whether they're going to override things and any mass gatherings at all will be banned. And I don't know exactly where they're thinking about mass gatherings, how many people they are actually thinking of. And it's I suppose that's Hunter. Do you think schools should close? Yeah, schools, and again, I don't. I think I probably should have waited a few minutes to see if anybody came on. I'll put this all most likely. I'm not sure how this video is viewed in terms of allowing people to see it on my the kind of the playlist of the videos I've done. Do I think schools should close? It's a very difficult one to decide whether school. Again, I said at the start, a few minutes ago, I volunteer at a charity shop, and these kind of situations. I think if there is the possibility, if there's a real outbreak in the area, then I obviously think schools should close. Uh, the risk of spreading the infection is very high. If it becomes a situation where I don't know exactly even how high you should really term it in terms of, cases. And again, I'm not a medical expert. I'm, I've seen over the years several of these winter flu bugs and colds and everything like that happen. If an area starts becoming affected with even maybe a couple hundred cases, then in that area, schools should close to try and avoid spreading even further. Now, I'll get to the health stuff in a minute, but it's if an area, one of the things that I've seen in this situation is a lot of people, and obviously this is how it's been spread, is people traveling from areas affected like China, Italy. I believe there is a case. I mean, this is how it can spread. For example, this is a genuine Scottish case. There was somebody. I don't know how many people really know Scotland, but Shetland is an island right at the north of Scotland, basically, right up the north. And there's a couple of cases up there because somebody was in Italy, came back, and came into contact with somebody else. Don't know exact details because obviously they're not giving out the exact details, but two people ended up, the person who travelled and someone else who came in close contact, I suppose, guess family member, maybe neighbour, came in contact with them and was tested and came back positive for the coronavirus. So certainly, if there's an area, they need to do it area by area. If there is a decent amount of cases in such an area, schools, shops, do a lockdown. I think it's the most effective way to actually, to try and control it. And that is the only way really you can control a virus like this. I mean, I keep meaning to look on YouTube, but I also actually used to work as a kitchen porter, and there is videos. I'm sure must be one or two on YouTube where if you take a look, it's I can't remember what the exact it's called, but there's a powder stuff you can put on your hand. You put it on your hand, and it only shows up basically under UV light. And what it does is it shows that the powder representing bacteria, it spreads on every surface you touch. So it represents, say, let's say it represents coronavirus. Say I'm in the kitchen, I have coronavirus for whatever reason on my hand. I touch, um, a chopping board and a knife or whatever. I touch that, and then but by the UV light, there is some good videos I've seen on it. When I was at college, again there must be some similar on YouTube where you touch it, you see under UV light, it shows you the UV light where you've left powder on that chopping board, on that knife, on that surface. Somebody else comes along, you picks up something from the chopping board, picks up, moves something, and you see the powder transfer basically to them. That's how this kind of thing works. So controlled kind of lockdown. You see them that continues and continues. They'll move more powder elsewhere, and everywhere you go, you'll leave powder. And I don't know if I can find one on YouTube. I'll maybe try and put it in the description or something. I'll look for kitchen UV powder stuff, whatever. That's kind of how it spreads. That's exactly the greatest example I can see of like bacteria and viruses spreading. That's basically that's obviously how it works with contact. I don't know specific details about airborne, whether you can get it twice or not. Even that's something else I've been thinking. If you get over it, and obviously, again, I'm getting to the health thing before I wrap this up. The I think what we've seen before I get to the health thing. The one thing that I continually seen that I didn't agree with at the start, especially from the United States, and again, that's not again I was saying about watching the Donald Trump thing, and I know I'm jumping around here. I can understand America taking the viewpoint that or the action that they're doing in terms of banning travel. They banned travel from mainstream Europe a few days ago. I completely understand them doing that. It's like I don't know if anybody watches the Border Patrol type of programs, but you see there's one Australian, New Zealand one where I think it's just called Border Patrol here in the UK, something like that, where they've kept a lot of diseases in Australia out for things like foot and mouth. They've kept a lot of kind of diseases through plants and insects. Australia's kept a lot of that. I'll get to that in a second as well, Hunter. That's a good point. Was 100. Well, hopefully she enjoys the telegram if she gets. But I'll get to talk to you about that in a second. Australia has kept a lot of their diseases out, partly because they're physically so far away, and they became very, very strict on control of what can come in and what can't. So so it depends. Kind of lost my train of thought there, but you've got. I think I said banning movement. You try and restrict the movement, the spread of it. It's basically the only way, really, in terms of governments, you can do, and trying to control it. To try and I hate it. It's damaging a lot of hospitality, a lot of industry. Cafes, restaurants. We're all talking about that in the news. They're damaging a lot of those kind of businesses. Here in Dundee, we rely. There's quite a bit of tourism that goes on here, and again, the charity retail shop that I work in, You could literally stand. I mean, I've done it before. I do a couple few afternoons. You can witness about half a dozen languages at least in just a couple of hours. So it's the world is widespread. It's just, again, you kind of understand they've got to try and control it coming into their own country. In terms of health, again, Hunter. I'll just say is it Hunter or H Hunter? I know it's H Hunter, but obviously, I would believe it's Hunter. My gran is turning 100 April. I don't think I will be able to visit on her birthday, unfortunately. Again, yeah, Hunter. Yeah, I thought so. I don't want people. I'm always Hunter. I am continually complained at by the wrestling guys I know and friends I know about either mispronunciation. For example, just very quickly before I address your point, and thanks for making your comments. Tatanka, the wrestler, that's one of the things that people keep saying to me, even after about 8 years after he's been here. People say I thought it was Hunter, and I get called out for spelling stuff, especially when it's a weird name. Well, it's not Hunter's not a weird name, but if it's a weirder name that I'm not sure exactly how to pronounce it, I sometimes spell it out, and people make comments anyway. Yeah, the health thing. Now, I will say it again. I know I kind of some myself touch my face and wipe my nose there, but yeah, I know in terms of health. I was talking about America. It's basically kind of the same, personally, as America is kind of doing. It's almost like all in terms of in terms of visiting places. I know, and I don't know where you're from, Hunter, but I know that local hospitals. I know there's a local care homes. Look, I don't know. Again, I actually also I've got a bit of personal history. I actually volunteered at a daycare centre quite about a year or so ago now, for quite a few months. I don't know exactly how they are dealing with stuff, whether they'll be open or not. A lot of these places are actually telling relatives, do not come to visit your relatives, which is a bit unfortunate. Some of them can be very in a vulnerable state, and I don't. No offense, Hunter. I don't want to kind of go into your personal situation because it's not really my business. But some of these people are kind of in vulnerable states mentally, maybe dementia or certain health conditions. Some of them can be suffering from conditions which means they have a low immune system. In a lot of care homes and even hospitals, local hospital here in Dundee, Nine Wells, that's drastically just cut visiting hours to an hour in the afternoon and an hour or so in the evening. So they are obviously, and again, in a hospital, you've got a lot of people with low immune system. You're passing through. You've got, you've got the possibility of spreading the stuff, and that's the one thing. Again, I was thinking again before I go into the personal health, and I'm already gone about 23 and a half minutes now, so I will wrap this up so I'm not taking a lot of people's time and make this video really, really long. Because as I said, I might do an update in a couple of days depending on what we're doing. And depending on what's happening, what the latest advice is, and depending on what this mass gathering, especially if this mass gathering announcement gets made tomorrow or on the next couple of days, I will want to talk about it. It's I'll be honest, it's a very difficult situation again for things. They're banning mass gatherings of 500 people, but then the way I've been thinking about it, if you go in the city centres, there's a ton of people there going out shopping, and you can walk through the crowds, and it's about 500 people, at least. I mean, again, one of the charity shop, I go off the bus, walk through the city centre, and you've got guaranteed at least about 500 people in that area. So it's very difficult to even kind of, unless we're going on total lockdown, which currently isn't the situation in Scotland. We're not being threatened right now with a lockdown situation. We're not being told prepare for this, although obviously, as in a lot of places, and I've got friends who work in retail, they're literally seeing people come in buy lots of toilet paper, sanitizers, and I just had a discussion with a friend there. That he went into a shop just for things for to eat, just to make a curry, and half the shelves are empty of some of the stuff that he was wanting to get, just as a regular thing, just as regular shopping, and some of the food items that he wanted to get, the shelves were completely empty. But so it's unless we're not being threatened, we said, with lockdown in Scotland right at this time. Whether it's going to happen, potentially, I would rule it out. I said we've seen Spain going on lockdown on Monday. Italy is already on lockdown. Ireland, both, I think, Republic and Northern Ireland are potentially on lockdown, or certainly thinking about it. Again, I'm not 100% confident in the information, but it's potentially for lockdown. In terms of visiting, your grand. It depends on what the care home is saying. It depends on again the advice. It's horrible to think that you couldn't visit her on her birthday if she turned 100. Congratulations to her. It's unfortunately you just have to follow the advice best you can. I guess, as I said, and I'll wrap this up in a couple of minutes. I don't want to go really over about 30 minutes, but you kind of really just have to follow the basic advice, and just, unfortunately, it's one of those situations where you can't really risk it. I think it's best not to risk spreading the disease, getting it yourself. Again, like I said, like many of the advice says, many people that are generally very healthy, it seems, at least from what I'm seeing, they are. You'll get it. It's like another flu, horrible cold. You'll suffer with it for a few days, but generally, if you're fit and healthy, you'll make a recovery. But if you've got underlying health conditions, that's when it becomes more serious. And I think that is where we've seen a lot of the cases of people who unfortunately pass away, is when they've got serious underlying immune compromised conditions. What I will say, again, I was speaking to one of my sister-in-laws, and the advice is basically the same. She works as a nurse, and basically the advice that is being given out, I think, is basic. Again, the common sense: you just keep your own personal hygiene standards up, whether we're on lockdown or not. Or whether you're going out again. Again, that's a really fluid situation, changing situation. I said America's just banned travel to from the UK, so many events people want to go to events or pretty stuff. But I think generally, I will end on this. Generally, my general advice, not that I'm again an expert, but I think just try and keep in a situation like this of trying to avoid catching if there's a flu or a bug going around. I think the general advice is just the same as it would be normally. Just keep your hygiene levels up, wash your hands, and when going to the toilet, preparing food, maybe a couple of times, even if you want to do after certain periods, use hand sanitizer. Which some people have been said, some of the gels can have bacteria grow in them, but use soap and water and keep your basic hygiene levels up as much as you can. And I think that's the only really way that you can do anything. I'll be honest. I think that's basically the best advice you can do, is just try and keep your own personal hygiene standards up. Wash your hands, take showers, baths, whatever. I think that is the best advice. I mean, that's the kind of, and like I said, I'm not an expert, but that is kind of the advice that I've kind of followed when I was studying hospitality in college. It's the advice that I followed when I was kitchen porter, a local. There's noise outside, but it's kind of the advice that I followed when I was a kitchen porter at Tayside Contracts, which is a local council-owned company. I worked there where they do the Meals on Wheels, and that's obviously meals for elderly and vulnerable people, and that's kind of the general advice that I follow. So it's basically the only thing you can think you can do is just try and keep your own self hygiene to a decent degree. Hopefully, everybody does that anyway, and that's basically all we can really honestly do. We can just try and um, try and do that. Um, so that, and honestly, that's the only advice I can give, and say before I end this is try and keep my own personal hygiene up. Again, I will do. Hopefully, if things change in Scotland, I will do an update in a day or two. Hopefully, it won't. Hopefully, we won't be affected as much, but we don't know. With all these travel bans, all this, getting all these events being cancelled, some forced to through legislation, others kind of having to take the decision to do it. Again, like I said, the Formula One was using the word, it's a very, very fluid situation, and that's what it is, unfortunately. So I'm going to end this here. Thanks for watching. It's again, things are changing. We keep also hearing that we're 4 weeks kind of behind everybody else just due to the amount of time, some of the action taken, and some of the really basically the time that the coronavirus has taken to reach the UK. So I do fear for a lockdown, but hopefully it won't happen. I like a lot of people saying about China trying to get kind of rid of it. That's where it originated in December. So this has been a long running thing. I'm just seriously hoping that we get this over sooner rather than later. But honestly, if you're a sports fan, if you're an event fan, if you're going to events, gigs, wrestling, even gatherings, support groups, or whatever, honestly, just expect disruption over the next few weeks and months. I think that's going to happen. Again, it's depending on what we get from, again, the UK government are going to override everything in Scotland, unfortunately. I think what they decide is going to overrun everything in Scotland, Wales, Northern Ireland at least. I think we just have to roll with it. Try and keep, again, I'll end on this, just try and look at the advice online if you can, follow it to the best of ability when you can, where you can. Try and keep your own personal hygiene to a decent standard, which I kind of keep saying. But just try and follow all of that advice, and hopefully we can all work and clear this. Hopefully sooner or later. But I said I think 2020 will be quite a year of disruption in sports, events, even people's personal lives, their jobs, and there's a whole lot of things I didn't get into. But absolutely coming up, it's going to be quite a mess in 2020 in regards to them. But just just try and roll with it. Don't. I know people are going to be upset, angry if events are cancelled or if they can't work, or if we do get a 2-week lockdown in the UK, which I certainly hope doesn't happen. I mean, I wouldn't be too bad as I'm not really a huge sociable person, but again, I hope everybody keeps safe, keeps their relatives safe. It's as I said, it's an ongoing and changing situation, and just I know I'm repeating. I never really know how to end these videos, unfortunately. Just keep to the guidelines, keep checking online the latest updates, check the news, see what they're saying. Just keep, doing whatever it is you're doing, just as you normally do to try and avoid the cold, a flu bug, whatever it is. I think that's honestly just the best you can do. That's the only thing you can do. Um, if you end up getting it, hopefully you won't. But as I said, like with many things, you can only try and protect yourself as much. I wouldn't say go up aggressively. Check out your people, friends and family, but and if there is vulnerable early, people try and give them support if you can. But absolutely, I've only gone 35 minutes, but just try and keep to the advice given by the public. Try and set hygiene levels up. That's all we can do. Honestly, that is all we can do. So I'll maybe make another live stream in a couple of days when we get more information, when we get further information exactly what the plans are going forward. I said I don't think we've seen or heard exactly yet as I've been doing this about what the UK government's plans are. That should be announced in the next couple of days. Whether schools should close, whether events will not be held. I don't honestly know, but like I said, again, I'm babbling on and I never know how to end any video, to be honest. Sometimes I just trail off and fade out the video. But again, the three main things: follow the advice that is given, because hopefully that advice will kind of try and make it pass over quickly. Keep your own health and hygiene up, and try not to stress and worry about it too much, because honestly, we're in a situation we can't really. If you follow 1 and 2, you can't really do much about it, to be honest. And things are, it's spreading. People are passing away, and it's a really horrible situation. I'm not trying to say this is a manageable situation or this has come out great for anybody, but yeah, just try and follow the advice, keep your own hygiene up, and try not to stress and worry. A lot of people these days, and I know I'm going on and on still, but a lot of people do suffer with anxiety, depression these kind of days, and this is another thing that may weigh on their mind. Some people maybe have gone through maybe a bad personal situation lately, but try not to worry about it. Try and just, again, do the best that you can, take it day by day, and following the advice and everything like that, and hopefully we can ride out this wave of the coronavirus, get it over and done with as soon as possible. But as I said, do be prepared and do be understanding if there is some disruption as we go on in 2020. Thanks a lot.